In April 2026, the luxury cruise ship MV Hantavirus was navigating the remote, icy reaches of the South Atlantic. Within days of departure, the voyage turned into a medical emergency. Healthy passengers began falling critically ill, leading to high-stakes evacuations and 3 deaths on board. Laboratory tests eventually identified the pathogen, Hantavirus, a rare and highly lethal virus. While a cruise ship outbreak makes global headlines, the broader risk of hantavirus exists in far more mundane environments, where it is much harder to detect. Hantaviruses are a family of viruses that trigger 2 distinct syndromes based on geography. In the Americas, it causes hantavirus pulmonary syndrome, or HPS. In Europe and Asia, it manifests as hemorrhagic fever with renal syndrome. The American strain is particularly dangerous, carrying a fatality rate of approximately 40%. The virus targets the vascular system, causing blood vessels to leak. Depending on the progression, this either causes the kidneys to fail or forces fluid into the lungs, effectively drowning the patient from the inside. The difficulty for clinicians is that there is no known cure, no specific antiviral treatment, and no FDA-approved vaccine. Hospitals can only provide supportive care, like mechanical intubation, while the body attempts to fight the infection. Because medical intervention is so limited once the disease takes hold, survival depends on stopping the virus before it ever enters the respiratory system. In the United States, the primary carrier of the virus is the deer mouse. These rodents function as asymptomatic vehicles. They shed the virus without ever becoming sick themselves. While many assume infection requires a bite, that is rarely how the virus reaches humans. Instead, the virus travels through aerosolization. Rodents shed the pathogen in their droppings, which eventually dry out. When disturbed, microscopic viral particles disperse into the air. If a person breathes this invisible dust, the virus settles directly into their lungs. Human-to-human transmission is almost never observed, but the Andes strain, found in South America and on the Hantavirus cruise ship, is a rare exception. For most victims, the danger isn't the rodent itself, but the invisible, airborne remnants left behind in enclosed spaces. Most infections occur in rural settings. Hikers, campers, and workers are exposed when opening up cabins, barns, or garages that have been closed all winter. After exposure, the virus remains dormant for an incubation period lasting between 1 and 8 weeks. The initial symptoms are deceptive because they look like a common seasonal flu. Patients experience fever, fatigue, and intense muscle aches in the thighs, hips, and back. The shift happens suddenly, 4 to 10 days later. Late-stage symptoms include severe coughing and shortness of breath as the lungs fill with fluid and the body enters acute shock. Because those early symptoms are so common, many patients don't realize they have hantavirus until the disease has already reached its most lethal stage. Since medical treatment is purely supportive and the decline is rapid, the window for effective intervention is narrow. This means the most effective defense happens outside of the hospital, through the way you manage and clean potentially infested environments. The most common mistake is also the most dangerous, using a broom or a vacuum to clean up mouse droppings. Dry sweeping effectively weaponizes the virus, launching the contaminated dust directly into your lungs. Safety begins with proper ventilation. You should open all doors and windows for at least 30 minutes before you start working in a potentially infested area. Your primary tool for cleaning isn't a brush, but a simple solution of household bleach and water. You must thoroughly spray any droppings with the bleach mixture until they are completely soaked. This keeps the dust on the ground and neutralizes the virus. UV sunlight can also be used to disinfect items that have been exposed. Proper protection is also required. Always wear rubber or latex gloves and use paper towels to pick up the soaked debris. Hantavirus is a lethal threat hiding in everyday dust, but the virus itself is biologically fragile. By understanding how it travels and choosing a spray bottle over a broom, you can stop the infection before it ever begins.